will discuss about disseminated intravascular coagulation. So what do you mean by disseminated word? Disseminated means that the process, the disease is not localized, it is taking place all over the body, and from the name it suggests that it is something to related to the coagulation. So let's see what is DIC. So DIC is an acquired disorder, and this is characterized by two things. So what happens is, due to some condition, due to some cause, there is activation of the coagulation, which leads to formation of a microthrombi. Now this is microthrombi. So microthrombi are formed all over the body in small blood vessels, and because the such number of small thrombi are formed, this leads to depletion of the coagulation factors and the platelets, and as these coagulation factors they get depleted, this will lead to bleeding. This is in journal what is DIC. So there are two things. This is a paradoxical condition in which thrombosis is also going on, as well as the bleeding is also going on. Now another name for DIC is also consumption coagulopathy. As the name suggests, it's a coagulopathy, that is, there is some abnormality in the coagulation, but it is also consumption. It is due to consumption of certain coagulation factors and the platelets. Now let's see, basically what happens is, due to widespread activation of the coagulation, due to numerous causes which we'll see, there is activation of the coagulation, there is platelet aggregation, and it leads to formation of microthrombi in the circulation. Now you should know, the previous video which I made on the topic of hemostasis. So in microthrombi, certain coagulation factors are used, certain intrinsic and extrinsic pathway of coagulation is used, there is fibrin formation. So all of these are formed, so that will lead to depletion of the clotting factors, depletion of the platelets, and also increase in the fibrinolysis. So we'll understand why fibrinolysis is increasing, because whenever there is in normal hemostasis also, whenever there is formation of thrombus, so what will happen, the body tries to clear this thrombus by the fibrinolytic pathway. So fibrinolytic pathway is a normal process, but here, because there are abnormal formation of microthrombi, there is increase in fibrinolysis, and the end product of the fibrinolysis are fibrin degradation products. So these are increased in case of DIC. Now what are the various causes of DIC? Now the causes will depend, there are numerous causes. They are not related to single organ system, because this is a disseminated disease. So which are the causes? Firstly, any sepsis or severe infection. If there is a person is in sepsis, it can go into DIC, the person can go into DIC. So various gram negative bacteria, meningococcal septicemia, your severe falciparum malaria, these can cause DIC. Then trauma. Why these cause DIC? We will discuss later on. Then trauma, especially any crush injury, any brain injury. Then obstetric causes. Obstetric causes, there are numerous obstetric causes known to cause DIC, such as amniotic fluid embolism, abruptio placentae, septic abortion, intrauterine retention of the dead fetus. So these all can cause DIC. Other causes are disseminated solid cancer. Now the DIC is further divided into acute and chronic DIC. So the solid cancers, they are known to cause chronic DIC. There is another acute promyelocytic leukemia. This is M3 variant of the AML. So this is also known to cause DIC. Then certain transfusion reactions, thermal injury, severe liver disease, giant hemangioma, these all can cause DIC. Another very important cause is a snake bite. Snake bite can also lead to DIC. Now why these things they are causing DIC? This is also important for you. Like we discussed, a cause was sepsis. Now sepsis In sepsis, certain components of the microorganism, lipopolysaccharides, these leads to uh, release of inflammatory cytokines which can further activate the coagulation system. Then severe trauma. Now severe trauma, again, due to release of fat and phospholipids, endothelial damage which is taking place, this activates coagulation pathway. In obstetric causes, there is leakage from the placenta. Okay, placenta contains a thromboplastin like material. Now thromboplastin like material, this will lead to activation by the activation of the tissue factor. So this also causes activation of the coagulation system. Similarly, in promyelocytic leukemia, it again releases a procoagulant substance resembling thromboplastin. So this can also cause your DIC. In snake bite, the reason is different. Snake bite, there is proteolytic activation of the coagulation factors. So if you remember, in intrinsic and extrinsic pathway, what happens? One factor gets proteolytically cleaved to activate another coagulation factor. So what does snakebite do? It proteolytically activates that coagulation factors. So you will understand from this diagram much more clear. So this is your intrinsic and extrinsic pathway. So some uh, diseases, they increase the activation of tissue factor, like your amniotic fluid embolism, in which there was thromboplastin like material. Okay, so all that will cause activation of the tissue factor. Then snake venom will directly proteolytically cleave each and every coagulation factor, the clotting factor, and will again lead to activation of the coagulation. So snake venom acts by this mechanism. So if you see, what happens is, there's coagulation pathway. We will not discuss that in detail, the coagulation pathway. You can watch the video on hemostasis for that. So factor 9 goes to factor 7, factor 5, then prothrombin is converted into thrombin, then finally the fibrinogen is converted into fibrin. This fibrin now is a thrombi. Now this is the formation of thrombi. Now what happens after formation of thrombus are 2-3 things. Firstly, wherever the thrombus is there, this will lead to tissue ischemia, because if there is thrombus over here, it cannot the blood cannot reach this organ, so it will lead to tissue ischemia. Okay, this is the one thing which will happen. Secondly, whenever the RBCs are passing through this blood vessel, okay, so if you're seeing, this is your thrombus. So whenever the blood RBCs are passing, so what will happen? They will get injured. So it will lead to a type of anemia, that is microangiopathic hemolytic anemia. So this will lead to fragmented RBCs. Then because of increase in the fibrinolysis, there will be increase in the fibrin degradation products, and due to consumption of the platelets and the coagulation factors, there will be bleeding which will be taking place. So this is in whole the pathogenesis of DIC. So we discussed till the time the fibrinogen gets converted into fibrin monomers, okay, into fibrin clot. So what happens after that is fibrinolytic pathway. So here the plasmin converts the fibrin clot into fibrin degradation products. So fibrin degradation products are again of various types. So whenever the clot is formed mature, it is fibrin clot, it will lead to formation of, after fibrinolytic pathway, fibrin degradation products will be formed, and they will contain D dimer. Okay, so this D dimer is used to diagnose the case of DIC. Okay, other fibrin degradation products are not used, because even fibrinogen, when it is cleaved, it can cause fibrinogen degradation products. Only D dimer is used because it is released from a mature clot, that is fibrin clot. So the fibrin, the D dimer, if we want to check in a person, the two tests are they are both tests. There are qualitative tests are present, and then there are quantitative tests are present. Okay, so qualitative tests are used by latest agglutination method. So this is a technique which is used. Also very important cause which we missed earlier was COVID-19. COVID-19 is also known to cause DIC. So clinical features. So what will happen in a person suffering from DIC? So there is dominated by bleeding. The person will bleed from the venipuncture site, okay, from the recent wounds. It can be generalized bleeding into the gastrointestinal tract, into the lungs. In the case of obstetric cases, the vaginal bleeding, which is not getting cured. So these can be seen. Now they are going to the types of DIC. There are two types of DIC. First is acute and or known as decompensated DIC. Then you have your chronic form. So as the name suggests, this is a rapid and extensive activation of coagulation will occur here. So this is acute, and this will lead to again your consumption of coagulation factors and widespread thrombosis with, causing end organ damage. So the examples are of acute are sepsis, trauma. So these lead to acute type of DIC. Obstetric causes, they also such as amniotic fluid embolism, these will all lead to acute type of DIC. So what will happen in acute? There will be sudden onset of spontaneous bleeding. Again, bleeding can be into the skin, into GIT tract. They can hematuria, epistaxis, oozing from the venipuncture site. So these can be present. Then there is a condition known as purpurafulminance. So if you can see over here, you can see there is area, there is a bleeding under the skin. This is known as purpurafulminance, and this is a indicator of a DIC in a person. So chronic or compensated DIC. Now here what will happen? There is a slow activation of coagulation. Now acute DIC is an emergency condition. It has a very bad prognosis in sense, but chronic is a mild disease. Now here what happens? There is slow activation of the coagulation which is going on. Okay. Also the clinical features here are very minimal. Only the laboratory findings you will see there is a feature of DIC. So what are the reasons? Reasons can be intrauterine retention of a dead fetus, any malignancy such as many solid tumors, hemangioma, okay, liver disease. So these can lead to chronic type of DIC, and it's a very mild as compared to acute DIC. Now in case of lab investigations, if you go for it, so you can make out firstly if you see the PBS, okay, that is the CBC along with the peripheral blood smear. So you can see there are formation of schistocytes, that are fragmented RBCs on the blood smear. Okay, this is one indicator. Then you can see there are low platelet count is present. Why? Because of consumption of platelet count. Then there is prolonged PT and APTT. Okay, now these are prolonged because of consumption of coagulation factors. Fibrinogen is also reduced because of its consumption. Now what is increased? Increases FDP and D dimers, which are byproduct of when there is a fibrinolytic pathway going on. So in this picture you can see, so these are the normal RBCs. Okay, so here you can see this is a schistocyte. It is fragmented. So numerous schistocytes gives suspicion of any hemolytic process which is going on in the body. So there is also a scoring system by the International Society of Thrombosis and Hemostasis. So it takes into account various things such as your PT, then fibrinogen, then D dimer and platelet, and it assigns various points according to the values. Okay, so if there are more than 5 points, it is positive for DIC. Okay, it takes into account like if we take D dimer, so if it is less than 400, okay, it will be 0 point. Then it is, if it is more 400 to 4000, it will be given 2 points. If it's more than 4000, it's given 3 points. Similarly, fibrinogen, it's more than 100 is fine, but if it's less than 100, it is given 1 point. So similarly, we add up and see if the points are more than 5, it is positive for DIC, and if it is less than 5, then it's negative. But if there is ongoing concern for DIC, that means the clinical suspicion is very high, so this test can be repeated after 12 to 24 hours. So the management, the treatment is mainly the management of the underlying disease process. That is very important. Then second treatment will depend upon in which phase of the patient is in, whether the patient is in bleeding phase. Okay, if the patient is in bleeding phase, we will try to give the cryoprecipitate, we will try to give fresh frozen plasma, platelet concentrate, so that the bleeding can be stopped. But if the patient is in thrombotic state, okay, so treatment such as heparin can be given in that cases. Okay, then main thing is, firstly you will try to manage the underlying disease process and the supportive treatment. That means because of any DIC, there is end organ damage going on, so there is any shock, we want to treat that. If there is kidney failure going on, we have to treat that. We have to maintain the fluid electrolyte balance. So these treatment are given more priority. Okay, so this was about DIC. Thank you. You can ask any questions in the comment box. Thank you.